Welcome everyone to the new episode of CXO Talks at PharmaShots. I'm your host Aditya Singh. As you know, I'm editor-in-chief of PharmaShots. I'm father of two boys, husband of Superwoman, and I love to do explore. I love to explore new things. About my education, I'm a pharmacist by education, and I'm doing this podcast from Winnipeg, Canada. Coming to Josh Wittner. Today we have our guest here, Josh Wittner. Over to you, Josh, if you want to give a brief introduction about yourself and your company, and then we'll jump into a few questions here.
Gotcha. Well, first of all, thank you very much for having me and taking your lead on the introduction. I'm also a father but I have two daughters and a son, who are the pride and joy of my life. And I currently work as the president of Gene by Gene in North America, and split my time between Houston and Australia. So as you can see, I've got an Australian accent. I've been based over in Houston for just coming up 5 years, and my children are based in Melbourne. So I tend to spend a lot of time going back and forth, but predominantly I'm spending my time in Houston as leading that business.
Perfect. Can you tell us a bit about the company and what's its history, how it started, and some
So
inspiration which give us a brief background about it?
absolutely. So Gene by Gene essentially has three business arms, and they're all actually quite distinct and play a different role within the market. The first, and I'll go in chronological order of when they were founded. The first was the business Family Tree DNA, which is a direct-to-consumer genetic genealogy business, which was actually the first business that ever went to market in this space prior to some of the more commonly known businesses out there where you can get genetic testing done. So it was the first to go to market in the year 2000, founded out of Houston by Bennett Greenspan, and we have been actively selling direct-to-consumer across the US and globally for the past 25 years now. So it's been quite some time. We would have done testing for somewhere in the vicinity of 3 or 4 million customers in that time. When you think about direct-to-consumer genetic genealogy, you generally think, well, what is the information you're going to find out? You'll find out, your percentage split of your ancestry, wherever you come from, those types of things. I guess the difference with Family Tree DNA is that it offers two additional products that the competitive set generally don't offer, and that's mitochondrial testing, where you can test your maternal lineage and trace your ancestry back on your mother's side really quite well. And then we also do myDNA testing, which is the paternal line or the paternal lineage, so you can trace your lineage back on the male side as well. So that's the point of difference, where we can provide a fair bit of detail. And if you're trying to build out your family tree, or you have an interest in that area, it gives you a greater level of detail to be able to build that information out. So that's Family Tree DNA. That started off relatively small, and in the early days, people didn't know about it. And the original founders looked for a lab to be able to do that testing. They didn't have a lab at the time, and so they were sending it out to, I think it was to the University of Arizona back in the year 2000. And then after the first 5 years, some of the service that they were getting, and they thought they would be able to do a better job if they brought it in-house, and so therefore that was the birth of Gene by Gene. And Gene by Gene today is ultimately, it's a B2B, business to business genetic laboratory services business. Started off servicing just Family Tree DNA. So that's when they started to bring testing in-house and do the servicing in-house. If you fast forward, that's 2005, it's now been operating for 20 years. If you fast forward to where we are today, Gene by Gene as a business, it services roughly between 60 and 70 different genetic businesses out there. And you would probably know a lot of those businesses. We operate silently in the background. As a result, we have a huge amount of samples that come through our lab in Houston from right across the globe, across many, many different businesses. And I think that if we were to put a number on the number of samples that we're running through that lab, it would be in excess of 1 million per annum, which would probably put that business right up there in the top number of top three or 3 to 5 genetic laboratories within, well, certainly in the US, if not globally. So it provides a very critical service, and at the moment it's probably the largest arm of our business in terms of volume samples and revenue. So it plays a critical role and works with family tree DNA, but also works with our third business, which is myDNA. myDNA was founded in 2013 in Melbourne, Australia, and focused on the pharmacogenomics space. And for those who are not aware of what pharmacogenomics is, essentially it's a test that you swab, and it provides you with information about what your drug reactions would be to certain types of prescription drugs. Very common in the mental health space around antipsychotics and antidepressants, but also is used in a much broader spectrum than that. So it was founded by an associate professor, Les Sheffield, back in 2013. He is essentially viewed as the grandfather of genetics within Australia, and actually had NIPT testing brought into Australia as a government paid Medicare item way back in the day, and off the back of that success, went to the government, said, look, pharmacogenetic testing needs to be funded. This is 13 years ago, and it wasn't approved at the time. So we said, all right, I'm going to go and start my own business because people need access to this. So that business, it's our own product, it's our own report. We have our own R&D team, and so we're very, very well educated in the pharmacogenomics space and do a hell of a lot of work with a lot of big companies globally, and that's continuing to grow to this day. That's where it started, but it's more than that. It's our clinical reporting and non-clinical reporting arm. So we also offer other tests such as nutrigenomics or clinical reporting from the exome, where you look at things such as hereditary cancers or cardio panels or those types of things. There's a large array of services that we offer through myDNA. We have a number of contracts through that myDNA business, and obviously all of the testing that gets done in the background happens through the Gene by Gene laboratory services business. So they're all interconnected in some way. Having the family tree DNA business enables us to also be able to offer some of the myDNA products to the customers that sit within family tree DNA too. So there's benefits to be had right across the board with operating those 3 different business units.
All right, so you already gave answer to the second question, which I'm going to ask. But yeah, then let's move on to let's discuss how this merger started. Like, what were your thought process, and how the merger started, and with the myDNA, with family tree DNA and gene by gene. So how this thought started, and then
it's a good question. And certainly, look, I've been in the myDNA business for, well, it's 7.5 years now, and I remember when I first joined, we weren't part of the larger group. It was the myDNA business based out of Melbourne, Australia, and I was certainly the US market was attractive to us and far more progressed and larger than what the Australian market was. So I was spending a lot of time heading over to the US to sell what we think is probably one of the most advanced pharmacogenetic tests available in terms of what we deliver and how we support it. As we were doing that, and as I was going in to meet a number of prospective clients, one of the challenges that we found was that we were talking about bringing samples back to the laboratory in Melbourne, Australia, and whilst we didn't see that as a huge challenge at the time, look, you put it on a plane and it's overnight, it's back into the country, we can get you those samples. It did prohibit us from winning a number of jobs, whether it be turnaround time becoming too long or clients not wanting samples to leave the country, those types of things. It became prohibitive to us. So we soon realised that if we wanted to play a role in the US market, that we couldn't just operate a lab out of Australia, and that what we needed to do was organise some sort of, whether it was teaming up with a service provider in the US or acquiring or merging with a lab, and it ended up being that we met the owners at the time of Gene by Gene / Family Tree DNA, who were looking for some sort of partner like us as well, where they could divest some of their interest within the business. But at the same time, they were excellent at genetic genealogy, absolutely fantastic at running a B2B lab, but did not actually have any clinical or non-clinical reporting services available to offer to their clients. And so that meant that there was a perfect and a natural fit for both of us. And it then became a question of, was there a certainly there was a natural business fit, but could we make the commercials work? And was there a great relationship built between both parties? And we did merge it was February 2021, right in the middle of COVID, which, that's a very, very difficult time to make a merger happen, because you can't fly back and forth. You couldn't fly in and out of Australia, that's for sure, unless it was just one way. So, but we thought that COVID would pass at some stage. Who knew how long it was going to happen? But it was an important step that we would take in building the business. So we went ahead with that anyway, and that's obviously, as I mentioned earlier, how I found myself, based over in Houston, and integrating the myDNA business into the business over here. And I think that whilst it was somewhat of a risk, flying over, I think I remember being on the plane. There was, because a lot of United were flying a lot of expat Australians from the US back out to Australia, and then the planes were going home empty, and I was on a plane with 5 people on it back. So it was quite surreal. But we took the punt, and we have managed to grow our business substantially since bringing them together, and those synergies have certainly paid off to where we sit today. We still continue to run the 2 different labs across 2 different countries, and as I mentioned earlier, I go back and forth quite somewhat. We take a hell of a lot of learnings out of what we do in the US, and look, I will say 95% of our business at the moment is in the US, but we do take a lot of our learnings from the US and bring that back into a market that's probably slightly behind in terms of the advancements and reimbursements and all of those types of things, and even consumer adoption. So we take a lot of those learnings, we bring them back, and it helps us progress other markets as well. And it's not just Australia, it's across Asia, and it's across Europe, where we have a strong footprint too. So there's been a hell of a lot of benefit in us, bringing those 3 companies together, and each of us playing our own role, but as one company.
All right. So this comes to a next question that I can see, and what I have read going to your website is that you are doing business like mostly in genealogy, pharmacogenomics, and nutrigenomics. So how this merger is benefiting you in terms of getting these 3 services which you have added after the merger?
Look, I think genealogy tends to sit on its arm out there. If you're interested in genetic genealogy, you play a lot in that space and you stay in that space. We have seen a lot of other genetic businesses trying to do cross-sell of other products into the customer base with varying levels of success. We've certainly done that. We've provided value and been able to offer our products into the Family Tree DNA base, which, we see it as, we don't see it as an opportunity just to drive revenue or cross-sell. Look, that is obviously a part of it, but we only do it where we see there's a valid benefit for the consumer base, and if we can align it with the existing products that they have. So that's been pretty good for us. So I guess the other thing is that, when you pair, and it's not just pharmacogenomics and nutrigenomics, it is also the clinical reporting from the exome. So when I talk about hereditary cancers and cardios, as I did before, it's actually being able to offer a broader suite to your customer base. So we work a lot in the background. We don't go directly to market. We don't go to physicians. We don't go to health. We don't actually go to the end user of those tests. So we're working with healthcare groups or other laboratories or whatever it may be. And so what we're able to do, instead of just going to those partners and offering pharmacogenomics, or just going to those partners who may have a distribution network of, let's call it 20, 30,000 integrative clinicians across the US, we're not just going in to say, we can provide you with detailed nutrigenomic reporting. We're going and saying we've got the opportunity here to provide you with whatever you would like across a large selection of products that we have available to you. And with that comes, some complexities. So we're very careful as to how we manage it, because some of this information is quite detailed. There is regulatory environment that you need to navigate, and you need to be able to provide the right level of education and training. So we're very careful that we don't just go to someone and try and sell as much as we can. We try and provide the right solutions to the right people at the right time. And we find that when we do that and we identify what those right solutions are and provide the correct education, backing, support, customer service, then we tend to have a greater level of success rather than just trying to push as much product as possible. That's what we've found really worked across these businesses. And when you start to get a name for yourself with expertise in one product set, it becomes easier for you to then start to sell your wares or provide credibility in other areas. So yeah.
Mhm. All right. So one more collaboration I would like to ask you. So regarding your collaboration with Ultima Genomics and a living laboratory. So can you please tell us what is these collaboration about?
Absolutely. So what I will say is that this collaboration with Ultima Genomics is one thing, and there's a collaboration with the Living Laboratory. That's another project. So there's actually two separate projects there. So
Mhm.
I'll talk about each one of them separately. I guess the first is it's a major breakthrough in what we're about to achieve, and we'll be talking about it here. It'll be one of the first platforms that will announce it. Is that for years, and I'll say, when I say years, I'd say for the past 10 years minimum, we've been running high volume arrays, and we've been running Illumina microarrays to provide services, in particular across genetic genealogy, and that's where we get large volumes from. And what we're doing in the partnership with Ultima is that we're looking at moving arrays across, or stopping utilizing the array services and moving it onto what's called low pass genome. And there's a number of reasons for making that move. So low pass genome is essentially a lower depth coverage of a whole genome. So it's next generation sequencing as opposed to doing array. It's a different technology in itself for those who aren't aware of the details of it. But sequencing has always been a far more expensive way to get information. It's a great way to get information. You can deep dive and get greater levels of depth and provide extra products and services to your customers from doing this. But generally, it's been cost prohibitive, and to do a low pass genome has never been as cost effective as what an array has in the past. If I just diverge somewhat for a quick minute, if I look back and say, what did it cost to do a whole genome? Let's call it 5 years ago, it probably would have been $4,000 or $5,000, something like that, for us to do it within the lab. That's just the sequencing element. I'm not talking about other elements of the laboratory process, but these days it's down at $80. For some of the partners, certainly the advertised price for Ultima at the moment is $80 for a genome. So you can see how much that's been brought down. That means that when you're doing a portion of the genome, that the cost per sample is much less than that $80, and it starts to become an option for you. Now the difficulty is within a laboratory is to be able to do low pass genomes at high volumes. We don't think that many have succeeded in doing high volumes in the human genetics space, and we're probably the first that will go to market and be servicing, near on 1 million samples per annum in the low pass genome space. So it's very, very exciting. We've built a hell of a lot of robotic automation into our lab, which, is great for a number of things. It helps us with it being able to manage high volumes for a start. Having robotic automation also removes so much of the human error that can occur through the through the sequencing process. So that's fantastic, but also it has a cost benefit too. The lab that has been built within Houston, we think is, one of, if not the leading, high volume next generation sequencing businesses that are in the US, and so therefore it's extremely exciting. I won't go into details of who will benefit on the end and some of our customers that will be using it, but for us to be able to acknowledge the partnership and the Ultima Genomics guys that have helped work very closely with our team to make this a possibility is incredible, and we look forward to be able to take this service to market over the next few years. We think it's an exciting time to be in next generation sequencing. So have you got any more questions around that project before I move on to the living laboratory?
Yeah, so we can move on to living laboratory and talk about a little bit about it.
Okay, so living laboratory is a different project. It's one that was took a couple of years for us to bring this one together as well. It's essentially living laboratory is the innovation arm of University of Glasgow, and we're working very, very closely with the Queen Elizabeth Hospital, which is the largest hospital in Europe, I believe, to bring in innovation of precision medicine through the NHS. So what we're doing there is a 2-year clinical trial where we're proving out the benefits of pharmacogenomics with the help of the Living Laboratory / University of Glasgow and the Queen Elizabeth Hospital with NHS patients. So it's exciting. We hope to process a few thousand samples, prove out that this innovative project works well from a drug recommendation perspective, which we know it will. But importantly as well, that what it does, it means that there's many commercial benefits, and that you save on additional customer or patient costs that you incur when you're not getting patients onto the right drug at the right time, or soon enough. So that's an extremely exciting project, and we hope that builds out to be something much bigger than what it currently is in a couple of years once we've finished that clinical trial.
All right, so I can see that both of sides are doing pretty much different kind of research, or you're getting a kind of a different flavors to your genetic research. Talking about let's change a bit gear here. So, can you tell us about what are the key gaps? Still, what are the key gaps in genetic testing, and how you are trying to address those gaps?
So, look, I think that's a pretty big and broad question that you're asking in relation to genetic testing. What I would have said to you a number of years ago is that I truly believe that everyone should have their genome sequenced, and that's just something that we should be doing. I would have said that the gap a few years ago is whether it's government, private, whatever type of funding for people to be able to get this done, because the reality is if it costs a laboratory $4,000 or $5,000 to sequence a genome, the add-on cost for someone to purchase it really just isn't affordable for the consumer. I think as where we sit today, a lot of that, most of that concern is starting to diminish. If we're at a level where that $5,000 has gone down to $80, it means that governments are more willing to look at funding these types of projects, or whether it be through newborns and sequencing the genomes of newborns, or whether it's in other areas, there is more funding coming for these types of works. Consumers themselves, we've seen it firsthand. The direct-to-consumer market for whole genomes is growing and growing rapidly, and that's essentially because accessibility to these products has just been has become available. To be able to jump online, and I think you can buy genomes for $200 or $300, $400 with reports these days that can give you critical information around what your genetic profile looks like, and things that you need to consider looking at based on your genome, and hereditary information and the genes that you've inherited from your mother and your father. So that's a really, really significant thing that I will say that has come. I think that, one of the challenges that we've always faced over the past sort of, well, certainly the 7.5 years I've been in it, but I know for a lot longer than that is education. Genetics is not the easiest thing in the world to understand, and it can be quite confronting when you get on and there's a lot of medical terms or genetic terms. And I've been working in the industry for 7.5 years, and I still don't know all of the details and the terms that are there. So I can see that it can be quite confronting for the consumer, but also for physicians who may have studied 15, 20, 30 years ago, but where genetics was never part of the courses or their education. So that's an ongoing element that we need to continue to address: education, having physicians, having consumers comfortable with understanding the reports and why they should do that. How is that being addressed? I think that with broader adoption over time, it's becoming more and more common. It's certainly not the black box that it used to be. I think also with technology and the role that AI is starting to play in this space, where you used to go from where you'd have people manually doing interpretation to building into algorithms for computers to be able to doing that interpretation and having interpretation spit out results. It's becoming easier and easier and more digestible with AI and AI platforms, and so that's going to help the industry move significantly over the next couple of years. So I think if you look at cost, knowledge and education, accessibility, all those types of things, they are being very much addressed as we speak. And I think also, when you look at funding for this, when you've got, certainly in the US, there's a lot of government funding for these types of tests because they recognize the benefit that it brings. And that's starting to roll out across other countries and other areas across the world. So a lot of the concerns that have been occurring, or difficulties and the challenges and the things that we've been banging our heads against the wall on for the past number of years, are really starting to unlock. And I think it's without doubt the most exciting time to be in part of this industry and be working in genetics as it continues to evolve, becomes more accessible, and not just more accessible, better products. So that's where we're sort of sitting.
So you already touched upon one of my favorite topic, artificial intelligence or AI. So how this is helping you or your company or genetic testing in overall, if you can put some light on that.
Well, I think okay, so I think I alluded to it just before when I was speaking. So for the past number of years, we would get a genetic test, do the swab, send it to in most cases, and I'm talking about a clinical test here, we'd send a clinical report to a physician, and we would try and make it as digestible as possible within that report, but it still can be quite confronting. And you're asking a physician to sit down in front of a patient and interpret a long, lengthy report. Being in the industry, and I won't sort of go into details of what are the platforms and what does it look like and how does it work, but essentially where it's getting far better and where AI is providing so much value is that it can interpret the reports and spit out exactly what the doctor or the physician needs to know in order to help or support their patient. And so that interpretation or knowledge or level of understanding that the physician may have needed to have when it was a simple PDF report is starting to be significantly reduced. Now, I think obviously it's still very, very important to understand anything that has some prescribing or implications for a patient, but the way to understand the report and what it's telling you is becoming far easier with AI. And I think it's not just on for physicians and clinical reports, it's also in the consumer space as well. I mean, for those that is just starting to get into genetic genealogy, they'll know that sometimes it's not always the easiest to understand all of the detailed information that you're being provided, especially when you're doing huge deep dives in certain areas. So we're starting to see some tools that are available to help consumers understand what all this stuff means and be able to explain it to them without them having to, have a degree in genetics to be able to follow that lineage and follow their ancestry. So there's a lot of benefit that's coming through on that front.
All right, so we're almost in the middle of our discussion here, and things are getting too technical here. So I would like to ask you something which lighten the mood. Is that how you spend your time, leisure time, while you are not working? So I can see you are traveling a lot from Houston to Melbourne and then coming back. So your thoughts or what you do in your leisure time.
Thank you and thanks for the interest. I guess, I mean, there's probably a few things that I would say. One is, look, we all work pretty hard, but I'd like to say that I work to live and don't live to work. And so, when I've ever got the opportunity, first things first, you are working a lot. It's spending time with my children. That's probably the most important thing to me. Quality time with the kids and whatever it may be. Whether you're cooking with them or you're going out and doing an activity, it's making sure that you've got quality time, and that means putting your phone away, and it's quality, not necessarily quantity for me, given how much I travel. So that's the most important. I'm a big traveler, so I'd like to tick off the countries. I love to get around. I think I'm nearing 60 countries that I've visited now, and I just think that's an incredibly important part of learning and understanding and knowing about different cultural differences across the globe and how people live and how lucky some of us are to be doing what we're doing. And I just love it, and I love spending time speaking with people and learning about different cultures, activities, foods, religions, anything. So I love that. But then my other one that I never get enough time to do, and I've never got the opportunity to bring it down, is, and that's my handicap. I love playing golf. So I'd love to be able to say that I played 10 to 12 times a year, once a month, but I don't. But that's where I get out and have a bit of, that's my me time out in nature and hitting a ball around that frustrates me, but I love it to death.
That's great to hear that you are still able to pull some time and giving that to your family and giving that time to, I think I'll use the word rejuvenate after working a lot. So coming on to my next question here is that let's talk about the regulatory and compliance. So how your company ensure that compliance in terms of handling the data which is being generated after genetic testing or consumers genealogy, how it's being handled? And
yeah, I guess there's two things here that I would say. One is that there's consumers should look out for the privacy terms of service within any individual company. So an individual company has the rights to develop their privacy terms of service. So have a look at that. We've always made a decision as a business that we will never sell your data without previous permission, but we've never done that anyway, and we certainly don't think that we ever will. So, but some companies will, and that's their choice. So, if you're worried about that, I would look at the terms of service. I'd go and look at the privacy clauses within each individual company that you're considering purchasing a genetic test from, and see where your data may or may not be used. So that's probably the first thing. So choose the company that you give your DNA to wisely and how you think is best. Because there are a number of companies that do sell data off the back of the testing, generally not at an individual level, it's at an aggregated level, but there are a lot of companies that do that. So you need to make a personal decision as to what you think is right for you. There is no right or wrong answer on that one. That's an individual preference or choice. The other thing is, we obviously take it very, very seriously. You can't afford to slip up in this space. So, we're very much compliant with, the GDPR, the European Regulatory Authority, which is one of the strictest going around, as well as HIPAA within the US, and we take that on board. So we have a significant engineering and software and cloud-based services that sit in the background, which is all encrypted, compliant to both the regulatory environments of GDPR and HIPAA and et cetera, but also to our terms and service. And we manage that within an inch of its life. So we understand the concerns that a lot of people have with hacking or access to personal data such as your genetics, and so therefore we put a lot behind it, and it's certainly one of the first topics that's spoken about at every board meeting as to the security, privacy of our customers and our customer data, and we're always continually evolving all of the steps we have in place to ensure that our customers' data is secure. So it's an individual case by case basis for a customer to decide where to give their genetics.
Perfect. So I have out of curiosity, I have one more question here. Is that do you see that there is some interesting facts which came after once you start doing the family trees or the family history thing? So something very interesting, if you like to share with us in terms of in general information, anything which is interesting information which you got after you do a genetic testing and then something interesting came up.
Yeah, sure. I mean, look, there's lots of different cases as to why consumers want to get into doing a genetic genealogy test, and there's a lot of the market that just has a level of curiosity that wants to know, okay, am I part from the UK and part from somewhere else, wherever the case may be. What does my actual background look like, and what's the percentage that I'm made up of? So there's a lot of people that do it for the curiosity element. There is a large genealogy community out there, very large genealogy community that are digging down and building some extremely large family trees and building them back a very, very long way too. So there are people that are strong enthusiasts that get right into it. And so we have a lot of those customers within the family tree DNA base, given the fact that we offer those different products that I mentioned earlier with the mitochondrial and the myDNA testing. So you do have your generalists that want to have interested and intrigued, and then you have your hardcore genealogists, and then I guess you do have people that are utilizing the services because they're looking to find someone or something, and whether it may be they'd lost a family member, or they wanted to know that they were adopted out as a child, whatever it may be, and they're looking to find someone. There are specific cases where they're looking to go back and do that, and there's been a lot of beautiful stories that have come out of people finding long lost loved ones over the years. So I think they're probably some of three of the larger markets that we have, and why people use our tests.
All right, so that reminds me, some time back I watched a movie, and it was based in UK. Someone got caught after 17 years. After there was a murder happened, and then someone caught after 17 years after they tested. Somehow the new technology is available now, where they are able to trace back to the parents and was able to identify. So that kind
That's
of
right.
interesting
So
thing
that's
also happened. Yeah.
forensic investigated genetic genealogy is what it's called, and some people abbreviate that to FIG. I'm not sure of the story that you're mentioning in the UK. However, it's become more and more common, and there's a much bigger industry that's growing and evolving now, certainly within the US. And the way that works is that if you have a sample specimen from a suspect, you can potentially you can take that specimen and then go back into a database and then build out a family tree DNA, a family tree to build it back to where the suspect may have come from. And certainly, we're not involved in doing that anymore. But certainly back in the day, this would be going back 7, maybe 8 years ago, maybe 9 years ago, where the FBI came to one of our founders, Bennett Greenspan, and was looking for a suspect, and a very well-known suspect, and we helped out at the time. As I said, it's not something that we're engaged in these days, but we helped out at the time, and it ended up leading the FBI to find the Golden State Killer. And I won't go into details of who the Golden State Killer is. You can look it up yourself. But someone that had been active 15 to 20 years ago and had done a lot of not nice things, but certainly had got older in their life, stopped doing things, but they did catch that person, the Golden State Killer. And he was a standard guy that I think he was 75 years old, give or take, living in the suburbs, just a usual guy next to you who had not been actively doing crimes anymore, but certainly had a long history and a very, very poor history from years ago. But they ended up catching up with him through forensic investigative genetic genealogy. So it does have a role to play in that space.
All right, so we are almost the end of this discussion here, and I only have my last question here, is that I'll ask 3 emerging technologies which are changing. Obviously, we talked about AI, but 3 emerging technologies which is changing the future of genetics or genetic testing.
Emerging. Okay, so I don't want to harp on it, but I will say that when we're talking about next generation sequencing and the accessibility just becoming so more available, what is coming with that? There's also different ways of doing next generation sequencing. So, and without going into the details of it, there are new technologies coming through. There's different technologies that sequence in different manners, and that's helping bring the accessibility there. So that is absolutely critical. More and more companies coming in with different solutions and different offerings. And that's probably the greatest. I think that will have the largest impact in the shortest amount of time, and will become far more mainstream. So that's the first thing. The second thing that really does come to mind is what's called epigenetics, and epigenetics essentially it looks at real time, right? So genetics generally is a one and done. You do the test, and it's what your genetic profile looks like. Epigenetics is slightly different, where it can look at your real time, how your body is processing a certain element, or what your biological age is. So you may be, you may be 48 years old from that's your actual age, but your biological age, depending on how well you've been treating your body, what you've been eating, maybe at 44 or 50 something if you've been heavily smoking, not doing much exercise, whatever it may be. I did read an article that Ronaldo, the famous soccer player, who I believe is late 30s now, has a biological age of about 30 or something like that. So because given how well he looks after his body, and I think that there's many examples of that across the globe. So that is something I do believe will become more and more powerful. Certainly age has a lot of evidence that sits behind it. I think where that industry sits at the moment, it's still not as accessible from a price perspective. However, it is growing. Costs are starting to come down as sequencing is, and it will become bigger and bigger. I think also real-time information as to, well, it may be how your body's processing certain nutrients, or whether you might need some additional B12s or what have you. It's got the ability to tell you real-time what that looks like, where in the past you might have had to go and get some bloods done or whatever to get that information. But here you can get an overarching view of your bio age plus what you should be focusing on to try and bring your age down. So I think that's a significant element. I think the other thing is, and and again, it's in sequencing. So, and I'm sorry for harping on, but turnaround times, the technology on being able to turn around a whole genome is getting less and less and less. And, if you look at what's out there at the moment, probably averages between, without being specific, but maybe 36 to 80 something hours, depending on the technology that you're using. I believe that there's more and more technology coming out, and in 2026 we'll see you be able to turn around a genome in maybe 6 or 7 hours, and that may not seem like a hell of a lot, but when you have, potentially if you're wanting to get a whole genome sequence because you have a sick child within the NICU, well, then you need to get that information as quickly as possible. And so turnaround time in some instances, maybe not for the general person who's sitting at home that wants to know their information about a whole genome, but for a physician that has a sick child sitting in the NICU that needs that information urgently, it has incredible impacts and possibilities. So I think that will potentially play I think that will play a huge role within the market. So they're probably three of the things that I would say when it comes to technologies and advancements within the genetic industry, without saying AI.
Yeah, so that's all from my side. If you like to add some closing notes here, anything you'd like to add here?
No, not really. I think we've covered a large range. All I would say is that I would encourage all to get their genome sequenced, and knowledge is power. And if you have the ability to understand, essentially the roadmap of what your body is and how it's built and what you need to look out for, well, then to help you live a healthier and longer life, well, then why wouldn't you do that if you have access to it? So I would just encourage everyone to consider getting their whole genome sequence with some reporting off the back of it.
Thank you, Josh, for being with us and for putting light on genetic testing, genealogy, and there are different more terms, pharmacogenomics and nutrigenomics. And also we'll touch a little bit of forensics here. So thank you for your time today, and I would like to see or like to touch base with you in near future and talk about more about how your business is growing or how the merger is helping you to grow further. Thank you for giving us your time.
Thanks very much for your time, Aditya. Lovely to spend the hour with you.